Hello, welcome to the Youth Transition Planning webinar video training for you all. My name is Rosemary Ivandetti. I'm the Independent Living Program Coordinator for DHS Child Welfare, and assisting with this training is Carrie Van Dyke, the ILP Youth Transition Specialist, and Jennifer Blakesley from Portland State University, lead researcher there. What we're going to do today is go over some our objectives of who, what, why, and when things are happening. So we're going to provide an overview of what's changing with transition planning and ILP services in Oregon starting in 2017. We'll explain the training or the thinking behind these changes, describe who will be affected and when. So whether you're a caseworker, supervisor, judge, or CRB member, you have some familiarity with what's coming and you know what to expect and how it affects you. A little bit of background. This was initiated by a 5-year planning process in 2014 with the aim to enhance transition planning services delivered by caseworkers and ILP providers. Also, we wanted to focus more on outcomes versus outputs. In other words, we know that transition planning is happening, but how do we develop statewide standards for tracking transition planning outcomes in terms of increased transition readiness as youth gain knowledge and skills and accomplish their goals? To do this, we first needed to develop a clear framework for transition planning and independent living services in Oregon, and link these directly to service provision and outcome assessment. First, state independent living programs are generally framed around federal guidelines for funding and tracking IL services and supports that are expected to lead to positive outcomes in young adulthood, including education, career preparation, risk prevention, money management, and housing. Additionally, we wanted to really think about how we would define the goals of Oregon's independent living programming to include the soft skills that need to be developed to promote success in these areas, such as problem solving, stress management, healthy coping skills, and stable relationships with supportive adults. And lastly, transition planning and ILP are proactive services that need to be focused on the long term, while also accommodating dynamic youth needs and challenges in the present day. We know how difficult this can be, which is why the framework is built around intentional, individualized youth engagement and assessment. To develop the framework and to think through how this would impact youth assessment, transition planning, and ILP services, we brought together a work group of contracted ILP providers from across the state, both rural and urban, large and small. This group has been meeting since spring of 2015. We also brought in Jennifer Blakesley from Portland State to add a research and program evaluation perspective to help inform the work group's efforts. We looked at existing tools others have developed for similar purposes. Lastly, in the past year, we have piloted all of the forms and processes we're going to introduce today, making changes along the way based on feedback from ILP providers, youth, and caseworkers. Now I'm going to hand it over to Jennifer to walk us through the purpose and philosophy behind the forms and processes the work group has developed.
Thank you, Rosemary. So one of the perspectives that was guiding the work groups was that the research and practice literature tells us that youth services are not one size fits all. Not all youth are going to have the same goals or be ready to learn the same skills at the same time. Learning happens in stages, and you have to be intentional about what you're teaching at what time. And you can't be working on everything all of the time. And like youth goals, youth readiness to engage in transition planning itself is determined by circumstances and development. And we want services to be able to flex with where the youth are at without losing sight of the big picture. So we needed to think about what are the indicators of readiness that we want for all youth before they exit the child welfare system. What are the outcomes that tell us that we're increasing transition readiness? And what are the areas where we want built-in flexibility to let transition planning be more youth-driven and accommodating? So as the work group started to consider what these outcome indicators might be, the first thing we had to address was life skills assessment. Oregon, like many other states, used the life skills assessment for many years. At the start of transition planning, youth would indicate on an online survey whether they had a long list of life skills in various areas. And the KC would then produce a report of areas for youth to work on with the help of providers and informal supports. It was suggested that the KC could be repeated each year, though this wasn't happening very often in Oregon. The KC also wasn't very individualized. All youth answered all the same questions, worded the same way. So overall, there were concerns that this approach might not be the best, or at least shouldn't be the only comprehensive assessment of youth transition readiness. Early decisions the work group made around youth assessment were that first, it should be more of a guided discussion than a one-time survey. It should accommodate youth circumstances and development, so not always assessing about skills that may not be relevant for some youth or not relevant yet, or that may be sensitive topics for some youth at some time points. Relatedly, it should promote rapport building with youth, where having young people take a survey on a computer often shut down rapport building. It should be repeated to allow for evaluation of youth progress over time. And assessment should clarify not just whether youth have a skill, but where they are along a spectrum of learning, from first developing an awareness of a topic and why it's important to understand, to actually gaining knowledge and learning skills, and then to applying these skills, initially with support and eventually without support. Lastly, assessment, transition planning, and ILP services should be directly linked. The resulting changes to the assessment process are the first two steps of the 5-step process we're introducing today. So we're going to look at step 2 first. So you can see that it's organized into 3 main areas: well-being and community, education and employment, and daily living, which include the required federal categories for independent living services, plus additional categories, a new one for personal growth and social development, and one for transportation and other life skills. The assessment is further divided into 3 stages of readiness: stage 1, awareness; stage 2, learning; and stage 3, doing. On the back of the assessment are instructions and a rubric for determining where to mark readiness within each domain, based on assessment of awareness, knowledge, and experience in using the skills covered within the category. For example, if youth demonstrated solid awareness of what college is and why it's important, but had not yet learned anything specific about getting into college and how to pay for it, then you might mark post-secondary education as the first circle in stage 1 or stage 2 for just starting to learn skills and gaining knowledge. The new assessment is completed to inform transition planning and ILP services and includes spaces to note important priorities or considerations relevant for that particular youth. This assessment is updated whenever the transition plan is updated and can be used to track increased readiness over time. The youth assessment summary is the new documentation of assessment, so this replaces the Casey Life Skills documentation. But how do you consistently determine where to mark youth are on these various domains? The first way is step 1, the Transition Readiness Discussion Guide. And we'll take a look at that on your screen. So the discussion guide was developed by the work group to allow for a more in-depth conversational approach to assessing youth awareness, knowledge, and experience in these domains. This discussion is designed to take place over multiple informal meetings with youth as youth begin the transition planning process. The questions are youth-friendly and open-ended and can be skipped or revised as needed, and the sections don't need to be covered in a specific order. The Step 1 guide includes space to take notes for later completion of the assessment summary and the transition plan. In most cases, you wouldn't go through the entire discussion guide again when you were conducting the 6-month update of the assessment summary and the plan, unless the youth had switched to a different caseworker or provider, or when there is a section that becomes more relevant for a youth. For example, discussion questions about sexuality or post-secondary education may not yet be relevant and could be covered as a discussion as youth get older and you update the transition plan. The next step is the Comprehensive Youth Transition Plan, or Step 3. In this case, the documentation is similar to what we've had in Oregon for a while, although the functions of the T1 Readiness Index and the T2 Transition Plan have been combined into one document. The new form includes transition readiness indicators throughout the categories, which are a cumulative list of outcomes we'd like to see for most youth by the time they exit the child welfare system. These are checked off over time, and most or all should be marked on the last transition plan prior to exit. The lower half of the transition planning pages are similar to the current T2, with sections to describe current status, long-term goals, and short-term tasks. The first page of the transition plan includes a section to describe the youth's involvement in the development of the plan, plus any other service plans that might be relevant, including the Casey, which is now optional, and a section for the youth to describe their strengths, challenges, and personal priorities in their own words. Here, as on the other forms, we've intentionally put the personal growth and social development section up front to communicate its importance. But we recognize this is a difficult section for many youth to complete first, and there's no need to fill this part of the plan out first. Now that we've covered steps 1 through 3, we'd like to show you how these work together. We have an overview graphic that shows what happens in the first 90 days. So as youth are beginning transition planning, the Step 2 assessment summary and the Step 3 transition plan are completed within 90 days, as informed by the discussion guide. For 14 to 15-year-olds, this process will be done by the caseworker. For youth 16 and older, this may be completed by the caseworker or by the local provider upon enrollment in the ILP program. After the initial 90-day engagement and assessment period, the assessment summary and the transition plan are then updated every 6 months, just as the T1 and the T2 are now. The solid lines around steps 2 and steps 3 on the graphic indicate that these are the things that are turned into central office, caseworkers, and/or the court. The last 2 steps are the most relevant for youth who are enrolled in ILP, although the framework of the Step 4 service planning checklist applies to all youth 14 and older. The service planning checklist is a concrete list of the 10 to 15 topics or skills within each domain that we want most youth to be familiar with prior to exiting care, with exceptions depending on development or circumstance. So looking at the service planning checklist, in the health, education, and risk prevention section, for example, you can see that we've listed a range of skills from healthy eating to dimensions of mental health to avoiding substance abuse. We can imagine that a youth who experiences developmental delays may be faced with barriers that prevent them from mastering some of these life skills in the various domains to the degree that another youth may. Additionally, many youth will gain knowledge and experience in some areas through foster parents at school or through supportive adults in their networks. One way or another, we're hoping youth have opportunities to gain these sets of skills on the checklist. The checklist also includes drop-down menus to specify which stage the young person is in for the particular skill, which may vary within the domain. In this way, the concrete checklist can be used in concert with the open-ended discussion guide, Step 1, to complete the Step 2 assessment summary. The purpose of the Step 4 service planning checklist is to serve as a cumulative record for providers to track the services they've delivered in these areas or the skills that youth have acquired in other ways so that we can keep track of the big picture goals to increase transition readiness. The checklist is not something that is generally completed all at once and is usually not turned in by the ILP provider unless requested by a caseworker. Lastly, we'll briefly look at the Step 5 monthly services and progress report, which has been revised to align with the previous steps. So this form is familiar and is used in familiar ways. To specifically, the ILP provider uses this to report to caseworkers in central office the monthly services. Step 5 will be used to specify when the Step 2 assessment summary and Step 3 transition plan are either coming due or have been completed, as well as the benchmark review. The monthly services and progress report shows which domains are open and are being worked on each month and at which stage, and or whether domains are currently on hold or have been closed as completed, with or without progress. When the ILP services overall are closing is determined on this form as well, and this form will replace the individual client profile upon discharge form. This is also where you'll record whether overall ILP service goals were achieved with this youth. ILP providers will also be able to use this form to specify specific barriers to service delivery and youth engagement to increase awareness of common barriers at the state level. And now I'll hand it back to Rosemary, who will give us a summary and talk about the timeline of the changes and how they'll affect you.
Okay, so these are the new forms and the overall process. And we just want to underscore a few points. For the initial assessment and transition planning development in the first 90 days, the 6-month update cycle will include steps 2 and 3. So if you look at the updates, which will be sent to the caseworkers and to central office. So if you're a caseworker completing steps 2 and 3, these can go to central office for review and feedback. Next, we want to be clear that the new process is designed to be flexible and intentional around skill building. We don't want people trying to cover all domains at once, because then we risk none of them getting the attention they need. For caseworkers receiving these forms from ILP providers, you may notice that they are focusing their efforts more closely in a few areas at a time. For caseworkers completing steps 2 and 3, we encourage you to do the same, intentionally focusing on some areas at a time and then focusing on new areas in the next 6-month period, as guided by the assessment, the transition plan, and most importantly, the youth. Accordingly, we expect to see that some areas of the transition plan will be marked as not an area being worked on at this time or not a priority at this time. We want to encourage everyone to use the Step 4 service planning checklist to guide their transition planning, to train new staff, and to use in supervision as needed. We started this webinar off by talking about the consistent framework for Oregon's independent living programming, and this is the most detailed version of what we want services to cover. Note that we will also distribute a IL services curriculum guide that lists specific resources such as online curricula or additional assessments, and we will keep this updated as we learn of the new tools. We have also piloted these forms and revised as needed over the past year, and we have received positive feedback. We've even had other states interested in adapting the forms and process for their own use. So, timeline for the rollout. Some ILP providers have been piloting in the last year, and all ILP providers will start using the new forms and processes in January 2017. To encourage the more intensive upfront engagement and assessment for new referrals, the ILP providers are being reimbursed at a higher rate for the first 90 days for the new youth engagement service, with expectations of 4 hours of time each month dedicated to creatively engaging youth in ILP programming and planning. We'd like to encourage caseworkers and foster parents to support ILP providers in helping to creatively get youth on board with ILP services. For caseworkers with 14 and 15-year-olds or older youth who are not in ILP, the new process rolls out in February. For supervisors, foster parents, CRBs, judges, and others, you'll begin seeing the new form soon if you haven't already. Now I'm going to hand it over to Carrie Van Dyke to let you know about the upcoming training around these changes.
Thanks, Rosemary. So as Rosemary said, we have a number of training resources that are currently in development. And our first training resource in this is this overview webinar. And we really encourage all of you to forward this to colleagues who will be affected by these changes. We will be providing more intensive implementation training to ILP providers in the coming months, so your local programs should actually be familiar with the more detailed requirements. We can also provide branch training on request. We will soon have a more detailed implementation webinar available, which will cover topics like lessons learned in using this new process with youth and how this impacts things like invoicing for ILP services, etc. We have also created materials and step-by-step instructions, including what goes to who, when charts, which will be made available to all. And we are currently in the process of updating the procedure manual. In addition, we have netlinks that are available with training, and these run quarterly as usual. So Rosemary has on the screen now our ILP website and the training dates, and we are updating the materials in those netlinks to incorporate the new youth engagement requirements. So the dates of the new trainings are starting in February, on February 2nd from 1 to 4:30, on May 16th from 1 to 4:30, on August 10th, 1 to 4:30, and November 7th, 1 to 4:30. And again, these are trainings that you can register through our iLearn Oregon website. And with that, I'm going to turn it over to Rosemary, who will be closing us out.
Thank you, Carrie. And in closing, we'd want to provide you with the list to our ILP and Youth Transitions team here at Central Office. This is our contact information. We hope that you are as excited as we are with the new process and forms, so please contact us with any questions you may have. Remember, these are changes in an effort to improve youth engagement in transition planning, in the transition planning process. With more engaged youth, we will see improved outcomes. Thank you for your time.